Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
Welcome to another insightful episode of Wellness Waves, where we bring you expert insights on health and wellness. I'm Rakhi, your host, and today we are diving into the world of robotics in joint replacement surgery. With us is Dr. Narayan Hulse, the Principal Director of Orthopaedics and a Senior Joint Replacement Surgeon at Fortis BG Road. He's a pioneer in robotic joint replacement surgeries in India. He has the credit of doing the first robotic direct interior hip replacement in the country. He has conducted about 2,000 robotic joint replacements in last 2 years. He specializes in complex joint replacements, direct interior hip replacements. Welcome, Dr. Hulse.
Thank you very much. Thanks for that great introduction. And also welcome all the viewers or listeners. Thank you.
So, Dr. Hulse, to start with, what are the latest advances in joint replacement surgery?
Joint replacement is one of the most successful human intervention to relieve pain and in millions of people all over the world. One of the most and the recent development which is changing the way these knee replacements are done today is a robotic technology which is recently introduced in this country in last 2 or 3 years, but it's being invented since last 20 years all over the world. That means you have got a new technology which is tried and tested all over the world, which is robotic technology for the joint replacement surgery.
Thanks for sharing that. And Dr. Hulse, please tell us the listeners as well, uh, do the robots actually perform the surgery?
Now, these surgeries are called robotic assisted surgeries, not really a robotic surgery. So I don't think anybody has to worry, will I be under the knife of a robot in a closed operation theater? No, these robots are handheld devices which a surgeon is going to control every minute of the operation. And hence, the robotics themselves, they don't do surgery, but the surgeon controls the robotic movement throughout the operation. Hence, they are safe and you guys don't have to worry about it.
Absolutely, sir. And so do tell us what exactly does a robot do then?
So the robotics are very good in terms of activities which are repetitive. They are very good, for example, in terms of the machinery, in terms of printing, the variety of industries. In fact, whichever the field in different industries where the robots are introduced, they have always been successful and they have never been removed. Rather, the utilization of the robots are becoming more and more. And also in orthopedic surgery and in a joint replacement surgery, these robots will help us to do those precise actions. For example, if you have to cut a bone at a particular angle, at 90 degrees, for example, the robot can cut exactly at 90 degrees, which the human beings cannot do because the human eye cannot make out the difference between 1 degree, 2 degree, 3 degree. So you can say that the robotics will do during surgery those activities under surgeon's supervision, which requires accurate calculation and accurate execution. For example, cutting a bone in a particular angle and placing the joint replacement component exactly in that particular angle. So the robotics, you can say, they intervene where a human mind cannot make those complex calculations and help you to achieve that precision during surgery.
Right, so we get that it's very, very precise and very, very accurate, which probably the surgeon can't really do. And what is the process involved in robotic assisted joint replacement surgery? You did introduce that a bit to us. Anything else you'd like to share on that?
Yeah, it's basically the robotic surgeries are done using proper planning even before the surgery. A patient comes to the hospital, he will get a CT scan done for the knee, and that CT scan will show us the exact anatomy of the bone. And using the CT scan and the software, we make a virtual three-dimensional model of the patient's knee. and we do a virtual surgery on that knee even before the patient has entered the operation theater. So we know exactly the size of the component, where exactly the knee replacement should be, how exactly the ligaments are going to be. Everything is calculated before the surgery. And when the patient is in the operation theater, surgeon does the preliminary exposure, the cutting the skin and the reaching the joint, etc. by hand. Then the robotic machine will come to the field, and the robotic machine will do exactly what has been calculated virtually a day before the surgery. And in fact, on the surgery day, if there needs to be an intra operative adjustment, that also can be done. So it is like a machine which calculates everything even before the surgery, and it can adapt to the changes even during the surgery and executes it so accurately wherever you have calculated where exactly your knee has to be.
So this pre-work helps preparing for the surgery better, and
Yeah.
it's very versatile as well. That time changes can be
Y-
made.
Yeah.
And our next question on next thought is, what are the advantages and disadvantages of robotic assisted surgery?
So the main advantage of the robotic science is the accuracy. For example, if you are asked to draw a straight line on a paper using a pen, we struggle. But a robot can do it 100 times, every time, each time accurately. I keep telling this example. You can have a nice, beautiful handwriting, and we appreciate that. But it is nothing like a printing every day. The print letter is same every day. That much of accuracy you get. So we get an X-ray after the operation, and we are all surprised every day in the ward. Sometimes we can't even make out was that an X-ray of a previous patient or a today's patient, because they all look exactly equal, exactly same. So that kind of accuracy you can get with a robo. All surgeons all over the world for so many years have tried to make it a very reproducible, perfect knee replacement x-rays, and hence these robotics will help you to get that kind of accuracy of the knee replacement placement inside your knee. It's very important. A surgeon will decide what angle your knee should be, and the robo will execute that exactly wherever you would like it to be. So the accuracy of the component position is the first advantage of using the robotic technology. Second thing, as I told you, is the repetitive activity which will remain constant. Whether the surgeon is coming in the morning or in the afternoon, whether the surgeon has a breakfast or not, the cuts and the operation and everything will remain same. It won't depend on the mood of the surgeon or the time of the surgeon and what exactly the mindset of the surgeon on that day, because everything will become calculated. Third thing we have seen in the hospital admission, the number of days they are going to stay in the hospital have been reduced. The pain is less, soft tissue release, what we call, is less, the bleeding is less. All of them have been shown to be in a variable amount benefit these patients who have a robotic assisted joint replacement surgery. We also think if a joint replacement is done properly using these kind of technology and in a more precision way, that knee should last longer and that knee should function better. And finally, it is the surgeon who is under control. Only thing what this robot does is, whatever has to be done, it will execute it properly.
These are the advantages, and any disadvantages?
Uh, Actually, there are no real disadvantages of using this machine because it's a tool used to do an operation which has been tried and tested all over the world. Now, the disadvantage you can say is that they are costly because they are under development. Any technology which comes will lead to an increased cost. It's variable in different hospital and different part of the world. So the robotic technology is slightly not so much costlier than a normal conventional knee replacement. Robotic technology also involves a training of the operation theater personnel, the doctors and everybody. So doctors have to retrain and learn those technology and tricks. The nurses, the operation theater, the X-ray, the CT scan. So the lot of learning, lot of training, lot of experience, etc. is required, and which is required in any technology we use. Robotics can also malfunction. For example, they being a machine, they can stop in the middle of the operation, or they can break down because it's another machine to handle for the hospital and for the biomedical department. But there are a lot of other safety features in it. Even if it is not working, if it stops functioning, there are methods in which that can be rectified within a second. So, and hence, even though we have these kind of operational issues, there are no real disadvantage of using the robotic. For example, you can say that the knee has been being done in millions of people since so many years now. The using the robotic will not really have any disadvantage, rather can add to the precision.
Thanks for highlighting on these aspects. And our next, thought or question is that is robotics used also in total knee replacement?
So the so far, the maximum use of the robotic has been a total knee replacement. Other uses have been the partial knee replacement, which I do in a younger patients because they are still not eligible for the total knee replacement. The partial knee replacements are done in people who are younger, less than 60 or 50-year olds, who are not having so much of the wear and tear of that knee joint. Only the part of the knee, the partial knee is involved. Those patients can have a very nice, small, tiny, mini invasive operation called a partial knee replacement. We use the robotic for a partial knee replacement as well. Robotic also used in few centers like our centers for an excellent total hip replacement surgery. And the total hip replacement surgery is done for the ball and socket joint, which is on the top end of our thigh bone. And that joint is very successfully managed with the hip replacement surgery. And in fact, that is one of the best operations available to relieve the pain in the entire body. And the robotic science is very nicely used for the hip replacement surgery. And there is something new, the latest development which has come, called a direct anterior hip replacement surgery, and we use robotic for the direct anterior hip replacement surgery as well.
Adding on to this, what you've shared, could you also explain a little more about robotic direct anterior hip replacement?
Correct. So the direct anterior hip replacement, which is becoming very popular in the American, the surgical work, is spread now all over the world. About 6, 7 years ago, when an American hip and knee surgeons meeting, they conducted a small survey, and which showed over 60% of the people have already moved to this direct anterior hip approach, making it like a more, the popular, or in fact, the approach or a technique which has become more popular compared to any other technique in a joint replacement surgery in recent time. In a normal hip replacement, hips are replaced using a big cut on the back of the hip joint, which is usually near the buttocks. It is about 15 to 20 centimeter in length. Whereas in the direct anterior approach, skin cut is done on the front of the hip joint, which is about 8 centimeter only. You can compare that, about 15 to 20 centimeter on the back of the hip and only 8 centimeter on the front of the hip joint. More than the skin cut, what is important is that in the direct anterior approach, very crucial muscles of the hip joints are not cut during the operation. Whereas in the back cut or the side cut, traditional approaches, we will have to cut a lot of these muscles to reach the hip joint. When the muscles are damaged, people can have more pain, more bleeding, and also the limp later on, and also the less function compared to the normal strong muscles of the hip joint, which is retained in the anterior or a front approach, what we prescribe in this direct anterior approach. So in generally, you can say that the direct anterior approach or a front approach gives less trauma to the patient, and it preserves the patient's muscle, and because of that, we assume that these patients will be doing great for many years with this kind of approaches.
Thank you so much for elaborating so nicely on direct anterior hip replacements. And Dr. Hulse, what has been your personal experience with robotic joint replacement surgeries?
So we have been, using robotic joint replacement technology over 2 years, and in this hospital, we are the one of the first adopters of the robotic technology in the country. In fact, as you have already mentioned, I did the first direct anterior robotic hip replacement in the country. In fact, we did the first 1,500, now it looks like the first 2,000 robotic joint replacements in the state as well. And we are one of the largest center for the robotic joint replacement surgery in the country. Our experience has been fantastic, and it is evidenced by the number of patients grow every month in our practice. In fact, for a surgeon, it feels so great that a happy patient comes back to us and tell us that I'm doing excellent. Not only that, he bring one of his friend or family or somebody. You also should have this operation from this surgeon, and it feels so good, that gratifying, that the patient's life has been made so comfortable and the pain has been removed and their mobility is restored by this technology.
That is so encouraging and good to know. And is there any particular example or any particular success story you'd like to share?
I can tell you several success stories, and there is nothing more gratifying than we keep remembering these successful stories which we have done, and with experience that goes on, we collect so many of those stories, and there are hundreds of them. One of them I can say that he's a cardiologist himself, he's a doctor himself, and he himself was worried whether he should have a surgery or not, considering the amount of the total process involved for an operation, which he knows himself. So he got both his knee replacement done. He's a cardiologist using robotic technology, and he did so well. Within 3 months, his own brother came for both knee replacement, own brother. And this happened about 2 years ago. You won't imagine that this cardiologist's wife got a knee replacement done last month, and his brother's son's friend's father and their brothers, they got a hip replacement done very recently. It is like in that chain of happy patients who are all doctors have got about 7 knee or a hip replacement done in that circle. Similar stories I have with many people as well. There are some of them who came to us on a stretcher because she never wanted to have an operation, because somebody has told her that the operations are bad. So she was managing with some kind of, the folk medicines or massages or something, until she was on a stretcher one day. I told her that you're already 78. This knee hip replacement should have been done 10 years ago. She came, got one knee done robotically. It was so successful that last week I see her back again here saying that, Doctor, I want the another knee done right now. So this is the kind of satisfaction these patients get. And for a surgeon, there is nothing more gratifying than these kind of stories we get on a daily basis.
Yes, thank you so much for sharing these success stories. And it must have been really, really great for the patients to have a good experience and be healthy and, walking very comfortably then after that and sharing those stories with others. So, Dr. Hulse, before we wrap up, do you have any final message for our listeners?
Very, very, the important that this message reach our people population all over the country. The joint replacements, if necessary, in about 5% of people who have severe pain in their joints, will transform their life. Don't suffer with pain in silence at home, and also don't go for an unproven remedies which only will prolong or sometimes complicate your problem. Reach out to a good trained joint replacement surgeon in your locality. Get your knee checked, get an x-ray done, get your hip checked, get an x-ray done. If somebody say to you that you will be good with a hip replacement or a knee replacement, especially using a robotic technology, take that advice and get a new mobility, get relief from pain, and get a new leash of life with your, the pain and the suffering which is gone.
Thank you for this useful advice. And thank you so much, Dr. Hulse, for sharing your expertise with us today. This has truly been an enlightening discussion.
Thank you very much.
And to our listeners, thank you for tuning in to Wellness Waves. Stay healthy, stay informed, and see you next time.